You have a spa. It's called Atomic Beauty. I saw that you guys are the official med spa of the Dallas Cowboy Cheerleaders, who
Right.
we all became familiar with the new Netflix
Yeah, right.
docu-series. Have you been
Right.
watching that?
I have been here and there. I haven't seen the whole one. I've been trying to keep up with House of Dragon, so I'm
Oh,
trying to split the two right now. But I will catch up. It's been really great. We've seen them. They actually had a show on the Country Music Channel too for a little bit too,
mhm.
and so they actually did some filming at our Atomic Beauty. So we've been kind of used to them coming around. Sometimes they'll show, film some of the things around the office as well. So it's been great. Um, it's a great sort of partnership. We get them to come in here and kind of brand our stuff as well. And of course,
Mhm.
we get to share that Cowboys brand. We're
Right.
very close to where they practice here in Frisco. So the players are right there, like half a mile down the road. So it's a nice partnership.
If you were going to give just a couple recommendations for people that are listening or watching that want to do a few things, maybe not surgical, maybe surgical,
Mhm.
that will improve the way they look, make them feel younger, look younger, what would be those few things that you would pick out for them?
Well, I think it depends on their age, right? So if a 20-year-old came to me and said, "What can I do to make sure I maintain my youthfulness and to do those things?" I would say it's pretty simple. Probably get on a skincare regimen that includes some sort of retinoic acid,
Mhm.
that you can use, a few times a week with a daily moisturizer and a sunscreen in it. That's pretty easy. It's really easy. I mean, they already have good skin. Protect the skin that they have because people don't know, but every sunburn you have between the ages of 12 and like 22, like a real bad sunburn that burns, even though you might heal from it, you're at higher risk of developing like a basal cell or squamous cell cancer on your face
Wow.
because of that sunburn, but it won't show up until your 60s. So you've damaged that DNA when you were younger, but you just won't see it until you get older. So a younger person's going to need a lot less. They can certainly get Botox if they want to prevent wrinkles. Now, if you're in your mid, let's say 30s and 40s, then I would say maybe doing a little bit more in addition to the skincare regimen, Botox. It's going to smooth out lines that might be showing up. So definitely Botox. If there's
Mhm.
any deficiencies, a little bit of filler to enhance the cheeks. If you have a weak jawline, you can do a little bit here. If you have wide masseters, we put in Botox into a masseter to narrow someone's face to give them that nice oval face.
Mhm.
Again, that's an assessment that you can do, but those are super easy to do, right? A lot
Right.
of Asians have wide jaws here and they do great with, Botox to the masseters. They
Right.
also do really great. And I saw that you talked to someone about fillers in the nose,
Mhm.
non-surgical. If they have a little indentation, you can use a filler to blend that out. If they have a bump, you can also use filler to blend that out. So whether it's a depression that you might see typical in Asian patients or your Middle Eastern patients who have bumps, you can smooth that out non-surgically if that's sort of just, your limited wanting of results. And then if you're older, you're going to need, sometimes you need the kitchen sink, right? So, if you're a 60, 70-year-old lady who's been in the sun her whole life, you might need a CO2 laser to essentially, I hate to say it this way, but it burns the first layer of your face off to
Right.
stimulate the collagen to really get it going. They're not good candidates for, doing sunscreen and retinoic acid because the damage is done. So I
Right.
think it's really more
But that
looking at
look of the surface, resurfacing your skin, that takes a lot of years off when you really fix that. I mean, that
yeah.
sometimes it has to do with the cheekbones and the lips and the nose and whatever it is you need to fix and fill and pull and tuck and whatever. But the way your skin looks, I think really ages someone or makes them look
Sure.
young.
Yeah, I think a woman can look very aged if you look at her neck and her décolleté, right?
Yeah.
So when you get a surfacing, not only should you get it here, make sure they hit the neck and the décolleté, and don't forget the hands. I've
Yeah.
seen people that look
Very
like they're in
important.
their 30s, but I can look at someone's hands and say, nah, no, you've done a great job on the face, but your hands kind of give it away.
Right.
So these are just little things that you can do to kind of help give you that little perk. But again, you can't come into a med spa with 30 years of smoking loose skin and go show me which laser. I direct them to the facial plastics and say you need a facelift. So
That's right.
uh, setting expectations. And one other thing, I heard the other, doctor you're talking to about, patients who are good candidates. It's okay to tell someone, no, I cannot help you. I'm not going to do something to make you potentially look worse or give you the false impression that you're going to look better.
Right.
And so when I say I can't help you, I feel sometimes just as good when I tell them in my hands, I can't help you, because you're not trying to get them in your practice just to spend money. It's okay to send people who are experts in those other fields. So
Right.
I think that's important.
Very important. All right. Everything you've said has been so interesting. You've given us a lot of information. But tell our listeners where they can find you.
So my practice is in Frisco, Texas. And you can find us on our handle. That's probably the easiest way. So it's at Real Dr. Dallas on our Instagram, Snapchat, TikTok. Now for TikTok, we kind of show some of the more funny sides of the office. If you check out at Real Dr. Dallas, kind of the things we do in the office, shows off a little bit of the personality. Snapchat is going to be the same thing at Real Dr. Dallas. That's going to be more the surgical side. I talk about the surgeries I'm going to be doing that day. We show the videos of the surgery actually in the operating room. So we can share some videos of that. We can send to you, whether it's pulling the skin down on a tummy tuck, repairing the muscles, from the surgical repair of the diastasis, injection of fat into the butt for BBL. And so these are all things that we show day in and day out. And that's the thing that you were saying. I think people have trust in what we do is because I'm not just showing it like once a month. I show new surgeries essentially every day of the week that I'm operating. So they understand like I'm really doing these things all the time. And the results I show on the table are things that I'm doing every single week. And so just knowing that I'm doing it, I think they build that trust. And then they see that there's I can talk to people and let them know and explain it to them in a way that they feel comfortable. So they're seeing our personalities too. And of course, a website, I think I have my assistant here. It's just my last name, www.Nájera or Nájera plasticsurgery.com. Nájera is Najera plastic surgery. If you just Google Dr. Dallas, it'll come up.
Perfect. And if anyone is listening to this episode, we will have clips of some of the things he was talking about with some of the video on our Instagrams. And then also, if you want to watch it on YouTube, we will have more clips of it there.
And if you want to see an implant that's ruptured that I cut right here, you can check it out. It's pretty cool because not everybody gets to see that. And that's really what's on the inside of an implant. But to see the inside of a surgery, that's cool too. So
right. Awesome. Thank you so much for your time. And I wish you the best of luck. Maybe I'll come in and see you for my BBL.
Sure. Well, I don't know if you have enough fat to take, honestly. So
well,
you might be limited in that.
We could find it from somewhere, I'm sure.
Okay. All right. Thank you very much, Rachel. Nice to meet you. And thanks for having me on.
Thank you so much.
Bye-bye.